Jennifer Berman, and I'm about to meet Christine Quinn from Selling Sunset. She's having a Votiva today, and I'm really excited for you to see. I am adjusting the machine now for Christine. We start with the temperature of 43 degrees, which is the standard cutoff temperature. We're going to do the inside and outside. So the inside really doesn't have any sensation. All the inside of the vagina feels is stretching or traction in and out or stretch. So it really doesn't have heat, thermal sensation fibers. The outside of the vagina, the labia, the mons, the clitoris, that feels heat, but the inside doesn't. So I can go up on the energy on the inside without her feeling discomfort. And I usually try to go about to an energy level of 33 to 35 for 10 minutes. So this is going to be recording the temperature. This is the time and the total energy delivered. We will record. Hi, Christine.
Hi, Dr. Berman.
So remind me again, you're 32?
Yes.
Okay, and then have you noticed any issues with vaginal dryness or irritation?
Not dryness or irritation, but I've noticed just my pH has been off sometimes.
Okay, and have you gotten urinary tract infections?
Definitely. I've always had those for years, as long as I can remember.
So recurrent urinary tract infections, concerns about the pH, and any issues. We talked about the Votiva for the function and health of vagina, but also from the aesthetic standpoint. You're still young, you have not had babies yet, but are there any concerns about the appearance, the labia?
I feel like it could always be better though, you know what I mean? I feel like it could always be, it could be perfect, it could still be better, you know what I mean?
But so to tighten the labia majora, as women age, and you're still on the young side, but it becomes deflated, more crinkly and droopy, the labia majora. Labia menora also tend to be longer. Sometimes there are young women that have asymmetry where one's longer than the other, or just anatomically they have more length, but you don't have those concerns. All right, so we're gonna do the Votiva today to help improve the pH, improve the epithelial lining, increase blood flow, increase the, I'm not gonna say tightness, but fullness, puffiness, health of your vagina, which is really important. And I think that you speaking about this as a young woman is going to do huge things for women in general, because we don't talk about our vaginas enough. Gosh darn it. And we're doing the Votiva.
Perfect.
It's minimally invasive. There is no downtime. You can go back to exercising, whatever it is you want to do. I ask that you do not have sex tonight, so for 24 hours, although you could, but I just want things to mold perfectly.
Right.
There's no pain, it's painless. There's no tissue that's being excised or cut. It's using radiofrequency heat, so gentle heat.
Wow.
You probably, when we're on the inside, you'll feel like pressure and poking a little bit annoying. On the outside, you'll just feel warm, sort of the probe on the outside, rubbing gently on the outside of the labia. Okay, so we set the energy temperature for 30. The cutoff temperature is 43, that's as high as it goes, it doesn't let you go higher. Pulse mode is repeat. So you're gonna feel the thing going in and out. And that feels annoying. It may feel like you have to pee, but you're not gonna pee. It may feel like you have to poop, but you're not gonna poop. And you're gonna hear the little beep. The beep beep is when she's at the correct temperature. And you can see the time going up, 54 seconds. So you have to do this for 10 minutes. Energy 35, we've done 10 minutes and 8 seconds, and total energy is 2.3. So that's what I have to record. We're gonna reset now for the outside area, and you can see it's gone down to 0. Votiva is a series of 3 treatments, 4 to 6 weeks apart, 6 weeks maximum, and we say 3 treatments. And by the way, the changes that occur will continue even after the treatment, so months after. So you really get the most, by the time, in about 6 months is the full effect. Wow. Which is why there's a stacking effect, which is why we recommend, and the studies show that the series of 3 treatments are important to get the most robust response. You probably will notice something after the first treatment, definitely after the second, but really it's important to do all three to get the lasting effect and the most robust effect. And that's it for my Votiva treatment today. If you want more information, go to my website at bermansexualhealth.com. I hope you enjoyed it.